So I know we have a room of fierce advocates here who are very passionate about this issue. Do you want to come to the mic?
Thank you. This has been very, very helpful. My concern is because of hearing the trauma beginning at such a young age, from the medical pediatricians, are they being identified? Is there a way for us to help pediatricians to get the knowledge that they need to start this early diagnosis and get a process rolling? That's one. The second thing is, do we really have enough mental health facilities to accommodate the need? And I think that that is where we are. We really don't have enough people out here in this field that can help the population that needs it. So I would like to see something like that develop. And I think, and I'm in agreement, is there's a lot of organizations that want to help, but again, you can't not get to the right people to get that done. Now, I'll just say this. I am working with pastors right now because the church needs to step up to the plate. They have the victim sitting in that church, they have the perpetrator sitting in there, and we have just started a national pastoral care domestic violence conference, and it's going to be held on October 29th. And this is going to be ongoing, so I'm going to be looking, and I thank, bless her heart, she worked so hard and is going to be a part to help us make this conference successful. Thank you so much, Hilda. We love you, and we love the work that you do. And so with that kind of help, we can make some changes, and that's what we want to do. Thank you.
Thank you. Your question is wonderful. First of all, the pastoral counseling community has, I think, over the last several years become much more engaged in looking at issues around mental illness and trauma and substance abuse. So congratulations on that. And I will also give you my card because we have some connections with some of the pastoral counseling leadership in America that might be helpful. The first question in terms of pediatricians. The American Academy of Pediatricians has actually made some policy statements recently about their interest in looking at trauma. And they actually have taken a position that they want themselves to become more trauma informed. I think one of the difficulties the pediatricians have is that we have to give them a simple tool, some simple screening opportunities, some simple assessment opportunities, and I think that some of those are in the works. So I think we can provide that within the healthcare system to pediatricians and, oh, by the way, primary care physicians as well. I think both that set of professionals are the ones who are, as you say, they are really the first line of defense in terms of reviewing them. Your second question about getting enough mental health treatment and enough mental health facilities. First of all, there are never enough mental health agencies, and I think that the need for both mental health and substance abuse agencies to be incorporating, and health centers, I might add, community health centers, all of them now understand that they need to be incorporating trauma-informed care. And with Helga's support, with Brian's support, we're trying to push that out as far as we can into different constituency groups so that you may not need a mental health clinic to be able to be helping people, but you could have someone in a pediatrician's office, in a child welfare agency, in foster care agencies, in emergency rooms, in a whole variety of places where hopefully people will be able to get either information or interventions that would be supportive. So there are never enough service providers. We also need to have our workforce, in other words, nurses, social workers, psychologists, psychiatrists, physicians, all of them informed through their professional training, which is also something we're trying to do, and work with them in terms of the curriculum. So, the attempt is there to make sure that we're all trauma informed and have, any doorway be one in which that trauma experience will be valued, recognized, and can be treated. Okay, sure.
I'm not sure. I don't think I'm going to make it to the thing. One of the strategies that we're using in Wisconsin is using the surveillance system set up by the Center for Disease Control to integrate the Adverse Childhood Experience Study into their module. So each state does a survey every year, and you can purchase parts of different surveys in order to measure where you are in these categories. So we have purchased the ACE module, and we'll be continuing to do that for the next several years. And I mention that because states can do the same thing and start to monitor their ACE scores and what if they're having an impact, you know, as we look generationally, but also we can use that with our policymakers. And one of the policy recommendations that we'll be making is for the AMA to look at this data and figure out what are you going to do? How would you best intervene with the situation that we're faced with? The addition to not having enough mental health practitioners, it is one of the arguments for trauma-informed care. We certainly need to support our clinicians, and we need as effective strategies as possible, but we're seeing schools as being a haven for kids. And so if we can get the school personnel on board, and not just the social workers, not just the classroom teachers, but the entire school community. So it's a sanctuary for kids when they go there every day.
I just make one point, which is that take everything that's been said here this morning, it's important to realize that this is really representative of the beginning of the journey. We're not in the middle, and we're not anywhere near the end of it. And so this is really about building capacity. And I think in each of the presenters here, what you've heard is that realization that everybody has a role to play, but we're really at the beginning. I can say, you know, I worked as chief of staff for the Chicago Public Schools for 2.5 years. And during that period of time, there were 90 enrolled students who were killed, murdered, and in addition to that, there were over 550 that had been shot. And when we looked at where those students lived and where they attended schools, there was that great proximity of both bad schools, lots of crime in the neighborhood, right? Low unemployment. And so there are these communities that we know have lots of these challenges coming at young children. And so I think as we go down this path of how do we do this right, I think we've got to give great consideration to that geographic nature of violence and making sure at the community we have the capacity to do that work. You know, I'm encouraged by some of the strategies that are emerging, which don't require a medical license or a deep clinical training in order to deliver trauma-informed care. There are increasingly manualized strategies that lay folk can be trained on that can be the front edge of the process of identifying children who need support. And the last point I'd make is, while there isn't consensus that there's a single screening tool that everybody would use, there's certainly a group of them that folks have been looking at in terms of good tools for beginning to screen. And the good news, at least in the child welfare field, is as it relates to the reauthorization of safe and stable families, it actually calls on states to provide a plan for how they intend to screen for issues of trauma. So again, we're at the beginning, we're not at the end. We need lots of support, but I think we're going in the right direction.
One of the things that I would highly recommend is the short video that you showed should be used by every OB/GYN and every prenatal for new mothers and fathers about how critical forming a healthy attachment is. That sets the stage for everything else.
I thank you, because that is
OB/GYN and every prenatal clinic.
And I just recently began to integrate that into my presentation, and for several reasons, not the least of which we often forget about infants. We think that they're going to be these just resilient little bundles of, you know, cuteness that aren't influenced by their environment. And to see Edtronic's work is pretty monumental. Yeah. Helga, are you? Yeah. Okay.
I'm Eileen King with Justice for Children, and thank you so much, Helga, for putting this together. I wanted to just go into a little bit of what you said about how important it is where children are telling and no one is listening to them. We have so many cases, and there are many of us sitting here who know about these cases where children have told about the abuse they've suffered. And when it gets into the court system, just the opposite happens as to what you'd expect. They're put in the hands of the very person who sexually assaulted or otherwise emotionally, physically abused them. And they're helped, this process is helped along, as you've said, Helga, by attorneys for children, parenting coordinators, best interest attorneys, law guardians, the judges themselves, and also just the system that wants to emphasize parental rights and contact over the safety of the child. So I'm wondering, is there a way, when we talk about getting rid of the silos that we seem to be separated in, is there a way to begin to coordinate so that people in the court systems and all of those corollary personnel who are involved, including child protection services, because this is all so intermixed, that they begin to understand what they're really looking at? Because we're seeing kids who are suicidal, who are being destroyed from the inside out from what they're suffering, and it's being misinterpreted or reinterpreted as being done by the person, the very person who's trying to help and protect that child. And there's a big conundrum here for those of us who are advocates across the country. And so that's one of the things I would urge, that there be this breaking down the silos, coordinating, and that there be materials available to people working within the court systems that help them understand what they're really seeing and how to best protect these kids. Thanks. I'm sorry, it wasn't a question, but would you do this? How can we help you do this?
And one of the comments that I want to make is actually be quite grateful to SAMHSA for some of the funds that Wisconsin has received through Transfer Initiative grants that has led us to the point that at the end of October, Governor Walker will be hosting a dinner where the leadership from the different departments, health services, children, family, correction, will come together and speak with Rob Anda, the co-principal investigator of the ACE study, to learn about this in a setting that will facilitate some conversation. Now, I don't know we would have been here at this place without SAMHSA's assistance. So to point out how we can start to come together to have a conversation. Yes.
Please.
Discuss a little bit more about preventative. This is, for instance, I'm a grandmother, and my two grandchildren were sexually abused by their biological father. And always with the worst possible outcome in the system. And for instance, I found this in the Illinois Proof of Fact book, a law book. Physicians fail to report child abuse for a myriad of reasons, from a fear of harming their practice to a fear of entanglement as a result of reporting. Legislation has not achieved the desired goals. Only a small percentage of cases are ever reported. So that is sort of one thing that's also a factor. It was a factor in our case. Our physician and pediatrician that diagnosed child sexual abuse based on my grandson's torn, bloody rectum, swollen to the size of a hardball, was, refused to report and refused to testify. And so that basically started off, the father responded to the child sexual abuse diagnosis by going into family court with a criminal attorney and was awarded sole custody based on parental alienation. And the abuse continued. And so there, and I have quite a lot more to say, but
your story is, we hear stories like this all the time, and that's why this discussion today is so important as a starting point. It's a starting point, and we hope that your grandson will be safe. We unfortunately have run out of time, so please, if you haven't signed up to the sign-in list, do so. We'll be in touch by email. This, again, is a starting point, and there will be a lot more to come. Thank you.